All right, hello and welcome to our fifth in our series of six webinars on virtual nursing 101 learning series. Today we are talking about selecting the right technology to partner for virtual nursing, and I'm thrilled to bring along some of my colleagues. One is Kat Harb, and she is our Senior Product Manager for virtual nursing, and Jacob Hansen, our Chief Product Officer. And I'm really excited about this topic. Just last week, we're coming off our digital summit. Hopefully some of you were able to attend that as well. And the theme for that was Start, Scale, Succeed. And I think that ties right in to what we're going to narrow in on today. And I think particularly our keynote speaker, Kat and Jacob, I think you remember this, Claire Zangerly, who is a nationally known nurse executive, talked about their decision to, when they were considering technology partner versus they were thinking about DIY. Could we DIY it ourselves, when she was the system chief nurse at Allegheny Health Network. And she said ultimately they decided, we know what we're best at and we know what we're not best at. We know we don't have the bandwidth for to support the kind of scalability, reliability, clinical and technical support, and research and development and all of that that needs to go into technology. So they wanted to go with a proven partner. And I think what we're going to kind of highlight the biggest needs or considerations when choosing a technology partner for virtual nursing, about the flexibility, the support, the demonstrated outcomes, and talk a little bit about the current solutions. So I'm really excited to kick it off to the experts in product management, a discipline that I'm learning about from working with you two. And thank you for being here with us today.
Thrilled to be here. Thanks, Lisbeth.
Thanks so much.
All right. Why don't we jump to our core topics. Again, thank you, Lisbeth, for the chance to come and participate in this webinar. We're excited on the product side of things to be a part of really focusing on how we bring our expertise to support our partners in their journey with these things. The four things we're going to cover here are the importance of the virtual care platform, that it needs to be flexible in the various things it supports, how technical and clinical support play a role in success as you roll out these things, excuse me, and the importance of working with a partner that's got some proof points under their belt, and then what our current offerings are in this area. So if we can advance forward to the next slide, we wanted to take a minute chatting about the importance of two things, and they're going to sound a little bit almost adverse in their relationship, but I want to clarify them. One is the value of a flexible virtual care platform, and at the same time that it needs to be purpose-built, that first bullet. What we mean when we say those things is, one, that the devices and the applications used have to be purpose-built for clinical use cases. You brought that up, Lisbeth, with the notion of do-it-yourself options and consumer-grade technologies that we know many had to try and evaluate and potentially pilot, especially during COVID. However, we know that as we work through those questions, the flexibility comes down to use cases. How do you take a virtual care platform that really works well for individual use cases, but expand use cases on top of that? And that could be use cases that we're focused on specifically at AvaSure, but then also how does the virtual care platform open up to allowing integration and participation with other vendors at the same time, all aimed at outcomes that will allow our customers and partners to grow, because it doesn't just stop with that first couple of use cases. Return on investment against that platform requires the ability to scale. And the last comment there, the last bullet there about artificial intelligence and machine learning, how does the technology that aims at each of those different use cases scale? Because we apply technology that will help the individuals that interact with those applications do more, work with as many patients as possible using their expertise. We can go ahead and advance to the next slide. So not only does it need to be flexible in terms of use cases, but I mean, everybody knows one hospital room does not equate to the same thing in every other room or unit type. So each unit type, the workflow could be somewhat different. So while it has to be purpose-built, it also needs to entertain the difference in those use cases and the level of technology that they require. So for example, in surge or ICU, the depth of Zoom might be a little bit more intense in terms of the need for individual use cases in those areas, how well you need to be able to see a patient versus another area where that might not be as important. You can see here at AvaSure, we have 3 different types of devices that support that flexibility, but each of them being purpose-built for a clinical environment. Let's go ahead and go to the next slide. So we have multiple use cases that we support now. The one I think most people associate us with right out of the gates is obviously Telesitter, but we've also got 2 others that we've added: clinical resource telenurse and expert oversight telenurse. Clinical resource is a focus on the more episodic use cases for virtual nursing. That could be admit and discharge, education, other consults. And then the expert oversight is really more on that coaching and mentoring side of things, where an expert nurse is supporting people at the bedside in a more continuous fashion. Could be in support of an entire unit or multiple units. And each of these things are things that the AvaSure virtual care platform can be applied to, these different use cases. And then in addition to that, there are also other partners that we intend to support in the future. Let's go on to the next slide. One of the things that I mentioned in the first slide in this section was about our philosophy on artificial intelligence. AI is a really hot topic for all of these use cases and for virtual care platforms in general. I have no doubt that every webinar that you might attend on technology, there's probably some discussion of AI. AI can mean so many things, right? It can mean computer vision, the way that we observe something with a camera and how we use computer vision to anticipate what patients are doing. It could mean ambient listening. It could mean predictive analytics. There's lots and lots of definitions of artificial intelligence. For us at AvaSure, we've started our journey in AI with a focus on computer vision. And our focus in this area has really been on taking some might call it conservative, but a very framework-driven and thoughtful approach to how we roll out AI. We know there's always going to need to be a human in the loop, and we know that when AI is deployed, it has to give both virtual monitoring techs and virtual nurses added confidence in the work that they do with patients, because above all else, we cannot allow for false positives and false negatives to overwhelm the clinical team or to put patient outcomes at risk in any way. So we've definitely taken a stepwise approach to delivering AI. We've now got limited release versions of artificial intelligence for computer vision offered, and are currently working with our first partners and customers on deploying those things. And we're excited about the scale that can bring to bear for those things that work on the virtual care platform that we deploy. Let's advance to the next slide.
Wait, Jacob, before you advance to the next slide, I want to make sure we kind of explain the how we're doing a two-pronged approach with the in-house engineers, because we have, I don't know, 50 engineers at AvaSure, and so we have a group that's working on AI in-house as well as external partnerships. So I don't know if you want to explain that a little bit, why we chose to do the two prongs at once instead of sort of putting all our eggs in one of the other baskets.
Yeah, that's a great topic, and thank you for bringing that up, Lisbeth. So as she mentioned, we do have our own in-house engineering function. Part of that is a team of people that are experts on and specifically working on artificial intelligence solutions. And like I said, the first thing they've deployed is computer vision aided augmentation or alerting. And maybe it would be helpful just to explain really quickly what that means. So from a sitting standpoint, for example, that would be computer vision having the ability to detect if a patient is getting close to leaving a room or getting close to getting out of bed or something like that. So in that case, we've developed our own internal offering, and we've done that because we know how important it is that we have an ability to support those models on our own. In addition, however, we also know that there are other entities out there that have computer vision, call them toolkits, like a software kit. And if our customers and partners have existing relationships with those, as a virtual care platform, we also know how important it is to be flexible, going back to that word flexible. Yeah. Therefore, we know we have to have the ability to not just use our own internal tools, but to embrace the use of third parties as well. And we're going to be delivering very near term our first third party relationships that will support that augmentation through AI through a third party rather than through our own internal AI. And we're fine with both of those. We see that as us meeting our customers where they are. That flexibility, support, whatever relationships, existing relationships that they have. And if they've got confidence in some other AI model that's been trained in their facility in the past, then we're willing to work with those cases. So great clarification.
Yeah, thanks.
All right, let's jump to the next the next slide. Okay, so when you think about AI, as I mentioned, it's really about creating scale, and it goes beyond individual use cases. So for AvaSure, we've started with the first three on this list. As I mentioned, computer vision falls in elopement. That's a computer looking at images and making a judgment about what we think a patient is doing, and then alerting virtual nurses or virtual monitoring technicians to let them know, hey, we see something happening here that we're concerned about that you may want to take action against. The third one on the list falls in the category of predictive analytics. In this case, that would be a system that looks at the EHR and takes about 50 different data points across all the patients in a facility. And then it creates a more stratified list of those patients based on their potential for being a falls risk. And it allows us to be more targeted in the places we deploy our technology because we know more about how much of a risk they represent. Going forward, we're going to apply AI in other places. Patient flow could be, is a room empty or occupied? Was it just occupied and now it's empty and therefore it's ready for another patient? Has EVS been in that room? Has it been cleaned? A really big one for us is violence. That's an ambient listening use case. So the microphone in our device is listening and detecting a risk of violence based on changing decibel levels or specific word uses. Lisbeth, I know you've been involved in some studies. If you wanted to speak to that for a
Yeah,
great.
I think what kind of sets us apart to be able to do that more quickly is the thousands of hospitals that we're in and the data that we already have from over 100 million hours of virtual sitting. And so OSHA has published that healthcare workers are 4 times more likely than workers in other industries to experience violence. And of healthcare workers, one-to-one sitters are way up on top of those most likely to experience violence, which makes sense because patients that need one-to-one sitters are often confused and can be fearful, and so it's fear-based kind of aggression that can happen against one-to-one sitters, whether it's delirium, dementia, substance use withdrawal, traumatic brain injury patients. These are all the patients that need one-to-one sitting. So yeah, we have taken the data that we have within the ORNA database that is part of our offerings, and published in the Journal of Nursing Care Quality about the words that are used, the slurs, and the degrading language threats. So it's verbal abuse, and then that often leads to physical abuse. So we can get upstream from that and alert ahead of time and just leverage the data that we're already sitting on to really get predictive. And I think on the elopement one too, I love that one because I've been in many, many monitor stations across the country, and there's always that one patient that's pacing around the room. They're not a fall risk. It's okay for them to walk. And they may be a little agitated in their pacing. So to have the camera follow them is really helpful and will allow monitoring staff to safely monitor more patients than kind of the 12 to 16 where we're at right now.
Yeah, absolutely. I mean, that's really in every single case, whether it's a virtual sitting use case or virtual nursing. And this list kind of different things for each one of those use cases. It's really about how much an individual, that human in the loop, how much can they scale their expertise, their knowledge, their know-how in supporting as many patients as possible. You see items like patient flow and rounding and patient turns. Certainly on the violence side of things, those probably fit best in that virtual nursing bucket. And then you've got things like falls and elopement and self-harm, where you're observing specific patients in a continuous way. But regardless of whether it's an episodic interaction or something that's continuous, more like sitting, AI can play a role in multiplying the efforts of individuals. And also, it's an interesting one. You mentioned that the patients that are pacing around, it helps connect us to the experience of, say, an observer, a virtual monitoring tech. You think about, there's one patient that might be not moving at all. They could be asleep. And then you've got another patient that's pacing around, and the variability in what you're patients for and how we think about that is really critical, the way it can support monitoring as many patients as possible, but then not go too far. And we know there's going to be limits to, when you think about cognitive burden on people that are using these tools. AI can help scale, but there will also be limits, right? There's not just this endless expectation of what AI should be able to do, because at some point it will it will outrun its ability to support what that individual can be helped with. So
I hear a theme emerging of balance. So we're balancing the human skill with the artificial skill to find this perfect balance, and also finding the perfect balance in being flexible and being purpose built. So that's what takes your whole department. That's why I'm really glad you're here.
In every few months, I feel like we're learning more about AI and what it can do beyond just healthcare. So this list might change in a year, right? There's going to be new things that we learn about that we want to take advantage of to help keep patients safe. So
yeah, I love the focus on keeping patients safe and this idea of balance, right? Purpose built for clinical use cases, but flexibility to expand both with the way we're supported by the technology and then into individual use cases. That's really why that's the way that we want to be the best partner possible, is by supporting those things. I think we're probably ready to move on to the next slide.
So the next key consideration is technical and clinical support. I think everyone on this call knows that system-wide change is hard, and system-wide change in a healthcare setting is especially difficult, and we want to be sensitive to that. So we want to make sure that we're partnering with a vendor that has expertise with that change and who's going to be there with you throughout this process, giving you best practices, listening to your needs, and adjusting the workflows as necessary. In addition to that, IT teams at these different health systems have a lot on their plates. We don't want them to be overburdened with implementing yet another platform. So we want to make sure that from a technical perspective, that we are covering you with project management and 24/7 customer care for technical issues, not just at the time of deployment, but throughout the entire partnership. Next slide, please. Here at AvaSure, it's probably no secret that we pride ourselves on our deep bench of clinical and technical team members that are here to support you throughout your journey. So prior to even determining the scope of the change that you want to bring to your system, we are there both clinically and technically through an on-site assessment. We come out, we meet with your teams, we understand how your system's functioning and how a virtual program can help. And prior to go live, we partner with you to design policies, workflows, share best practices, and figure out what metrics we want to track throughout your program to see its success. As your project progresses, we'll also work with you on integration so we can figure out how our solution can fit alongside your current technologies. So let's talk about during go live. During go live, we're there in person, working shoulder to shoulder with your staff to educate, ensure everything goes smoothly, and so we can collect feedback in real time, which a lot of that feedback will come back to our product team so we can figure out how to better these products in the future. But don't worry, when we leave at the end of the week, your team's going to be well equipped to continue education as your program grows. As a product manager for virtual nursing, I've had the pleasure at being at a handful of the go lives we have, and it's really been nice to see how quickly we build this workflow, we plan, but during go live, there are things that come up that we need to adjust for. And it's really critical to have a plan in place of how you plan on using the solution, but be willing to adjust and as it's put into practice. So don't be too rigid. I guess the word of the day is flexible, is what I'm learning on this webinar. And that goes as well when you want to put your workflow into practice.
Kat, what just popped into my mind is we had one virtual nurse go live, and I think you went there, but during the planning phase, we were doing it emergently because they were having an RSV crisis of their pediatric population, and they didn't have enough pediatric nurses to manage the onslaught of patients that we had. And we put it into place very quickly. And it was like 2 small care units across pediatric care units in different states within a health system. But then luckily the RSV surge abated. And so we switched gears, right? And you were there. And I don't know if you can talk a little bit about that as an example.
Yeah, so that is a great example. We had a health system that had a very specific way that they wanted to implement our virtual care solution. And as time went on, that wasn't as much of a need anymore, which is great, right? We like that it went down, but they were able to adjust, and we worked with them on how can we still leverage episodic care at the bedside with a virtual nurse in an adult setting instead. So we rewrote some of the policies, the workflows, and we looked at it in a different lens, and we were able to go live in that sense as well. So we were able to plan for one, adjust throughout the project, and then go live with a different one and kind of get a feel for how virtual care could help support their bedside teams.
Mm-hmm.
Hey, Kat.
Yeah, sure.
Sorry to jump in. I just
okay.
The first section there on program development support, those assessments and how they tie into the type of devices and those flexible use cases, I think it might be useful to talk a little bit about how those assessments might guide the selection of the types of devices or how we think about a return on those technologies that are selected. Any other thoughts you might share on how those assessments would play a role in that?
Definitely. So with a clinical and a technical rep at the assessment, we are looking at your floor plans. What do the rooms look like? What technologies do you have in there from a technical side? And then clinically, we're understanding what are the outcomes you're looking to achieve. So with both of those sides, we're able to figure out what's the best piece of technology that fits your rooms, what will accomplish the goal of what you're looking for with a virtual care program. So it's really important to have both sides of that equation, that you really come out with the best solution with the different offerings that we have for hospitals.
Yeah. So that it could be, you could have a certain unit where, behavioral health unit where devices in the ceiling that are purpose-built for that environment would make sense. You've got other areas where maybe two-way video supported with screens on mobile carts would make the biggest difference, and that assessment would all drive toward really thinking through, right? This is not just look, we have one thing and you take it and you put it in there and you make the best with it, but you're choosing the right things for each area. That makes a ton of sense. Thanks for letting me jump in there.
And the workflows, right? So part of that is what workflow should we target first, and going from there. Some of that is uncovered during the on-site assessment. We don't want you to be handed a bunch of papers and have to filter through and figure out what makes the most sense. We're going to guide you through that process and learn about your health system so we can give you a catered recommendation. A few more things on this slide before we progress. So, I talked a lot about the prep and the go live. One thing that I believe sets AvaSure apart is once go live is over, we are still paired with you. So we have a clinical success representative that gets assigned to your health system, and they're going to continuously review your workflows, how your program is going, and talk through those metrics that we established before the program went live. And then one thing, last but not least, is our customer care team. I want to make sure I do highlight them. We have such a strong customer care team that is there to support you 24/7 if any technical issues come up. So we'll have someone from a clinical side buddied up with you. We also have that technical team here to support you as the program progresses. Next slide, please.
Okay, I think that's sending it back my way. Thanks, Kat. So we want to chat a little bit about, in the product world, we always use this term proof points. But certainly the phrase demonstrated outcomes is probably a better way to say it. So when you think about the need for the right partner in virtual care, especially when we're trying to apply technology to new use cases all the time, it's critical to work with partners who have been through it, right? Who have tackled some of these challenges and know what it means to apply the technologies in continuous settings, in episodic settings, in a variety of unit types. And that's really what demonstrated outcomes are about. If we can jump to the next slide. So as a virtual care vendor, we've been in the space a long time. We started obviously with Telesitter. We've deployed across a really broad part of the inpatient acute market in particular, over 1,000 hospitals, and have started also deploying on the telenurse side of things. And that means that we've had the opportunity to deploy, and we started talking about this before, right? We've got solutions in med-surg, in ICU, in behavioral health, in emergency departments, in such a variety of these things. And there are so many gotchas, right? Things that you would never have thought about until you're in a very specific environment. That talked about workflow in the last section there, in a specific workflow. Until you've been in those spaces, working through it, there's just things that, of course, you wouldn't have thought of them until you've been through the excitement of putting something into production like that. And that's the expertise that we know we have to bring to bear with our partners because we've gone through that. Let's go to the next slide.
While we're going to the next slide, Jacob, like for example, a lot of times I think in pediatric hospitals or children's hospitals, they say, well, that's great for adults, but it's different, and it is different. And the pediatric setting is another example. So, and we've monitored over 17,000 pediatric kids on our devices and have learned a lot over the years, and have a few webinars and references to children's hospitals or care units, children or pediatric care units within an inpatient setting. So to be able to provide the references and the experience and lessons learned, so you can stand on other shoulders, because I think in healthcare we're very generous, and they're always willing to get on a webinar with us and talk about it, or pick up the phone and answer from another, somebody who's exploring possible solutions. So we're lucky to be in healthcare, and we're lucky to work with nurses in particular, because they're like very willing.
I was going to say, speaking of generosity, like we couldn't have a better customer base than people who by nature chose their profession because of that. And on the pediatric side, I think that's such a great example. Talk about a space where technology is needing to support a population that's got an ever more complex set of issues that they face.
Oh my gosh, yes. Mm-hmm.
Young people who come into a hospital who are dealing with incredible mental health challenges, and also the things that create a risk to their rehabilitation and recovery. And if even a little bit of difference in, one, keeping them safe, and then supporting that rehabilitation and getting them home or getting to the next place that they need to be, then that's a win. I also think your comment about generosity is an important one, because for us at AvaSure, taking those successes and applying them as many places as possible is a huge part of what gets us out of bed in the morning. And so you see the article and the peer-reviewed journals here. We love partnering with our customers on documenting and capturing what happened, why did it happen, what worked well, what didn't work well, right? Is it okay that things don't go well? Of course, right? But let's learn from it, and let's strengthen outcomes across healthcare as we work together on documenting the art of what's possible by matching technology and workflow to the betterment of what happens with patients. That's something we've done a lot of. You'll note here the notion of how many of our staff members are RNs. I love working alongside so many nurses. I'm not a nurse. Wish I was that cool. But
I'm going to show you something. That's my legacy. My mother, my grandmother, myself.
I love it. We are so lucky to work with so many nurses in our team, and like I said, this is what motivates us at work. This is what gets us excited. Is we have watched the outcomes. We've been a part of documenting them, and we want to do more of that going forward as we add more use cases. Right? We want to just continue to expand on those scholarly outcomes wherever possible. So
I will just say about the generosity. So this is not, so these are 120, it's probably 140 now if you count poster presentations. At AONL, there were 2 poster presentations from 2 of our customers. And we have a podium presentation coming up at Magnet in the fall. And we've accumulated this over the years. And I worked as a clinical nurse specialist for many years in a health system. That really wasn't part of your day job, or you weren't given extra time to write a poster or do a presentation or write up an article. You had to make time for it. And so that's much appreciated from all of these nurses and leaders that have taken the time out of their day job to share something that others can learn from.
Absolutely. Let's jump to I know we're using up a lot of our time here. Let's jump to the next section. Back to you, Kat.
Thanks. So the last key consideration is current solutions. So when you're assessing a partner for virtual care, you need to consider the wide breadth of technologies in play today, such as your clinical communication solution, maybe your EMR, and then finding a partner that fits nicely alongside those ecosystems. And not only is integration important, but integration that actually saves time for the clinicians or betters the patient experience really is key. It's one thing to say you can integrate. It's another thing to say that you can integrate in a way that helps the care teams throughout their journey. Next slide, please. Before I talk about some integration examples, I want to go back to something Jacob mentioned earlier. So flexibility, the word flexibility today, right? As we talked about earlier, you're going to want a platform that can scale and grow in various areas of care. And sometimes that can be difficult without a proven ROI. So we've seen time and time again that virtual sitting does have a clear ROI, $200,000 annually per device, and that really resonates with the leadership. So this clear savings makes it easier to get approval for that program. One thing we've been seeing is that hard ROI produced from sitting can be used to help jumpstart your virtual nursing pilot. So using that money to help support starting up that pilot in virtual nursing and kind of getting a feel for how that could benefit your system. Next slide, please.
I just put in the chat. I just put in the chat the reference for that $200,000 savings from that's a peer-reviewed article, Oregon Health and Sciences. So we didn't just make that number up.
I appreciate that.
Yeah.
Thank you. So last but not least, at AvaSure, there's 3 main types of integration that our customers are taking advantage of today. The first is orders from the EMR. So with that integration, hospitals can remove extra steps for both the bedside teams and the virtual safety attendant. So when an order is placed in the EMR, we can take that information automatically and put it into our system, which speeds up the time it takes to get a patient up and running and for it to be monitored, and also it removes paper from the equation. The second is outbound alarm integration. With this one, you can send the stat alarms right to the pockets of the appropriate caregivers, which will get someone there faster and prevent patient harm. Hospitals can also leverage like the dome lights outside of the room to give a visual indication to anyone nearby that a stat alarm is triggered. And this is especially helpful when there are multiple patients in the same area being monitored with telesitter. And we all know, well, maybe not all of us, but you will today, we know that there's an increase in falls when response times can go beyond 19.2 seconds. So we want to make sure we help get caregivers to the patient as fast as possible to avoid any patient harm. And last but not least is Epic Cal. So with most of the work being done in the EMR, so Epic in this situation, it makes sense to launch a video call between a virtual nurse and a patient from within that platform. So AvaSure integrates with Epic seamlessly to connect with the patient, all without leaving the EMR. This will save steps for the clinicians. They don't have to open another application and log in somewhere else. They can do all of this from within the EMR, which they're likely documenting in any way throughout this virtual visit. And I believe we are ready for the next slide. Lisbeth, back to you.
Okay, I am actually just putting in the chat also the link to the 19-second statistic. And so that was a multi-site study published in the Clinics of Geriatric Medicine from 71 different hospitals that demonstrated statistically significant higher incidence of falls on camera if the alarm response time was more than 19.2 seconds. So that's evidence from that ORNA database that we talked about previously. So you can fact check us. And so I'm very excited about our final session a month from now. Those of you that have blocked your calendars on these Thursdays, the last one is August 24th, noon Eastern Standard Time. And we're going to pull it all together. We're going to talk about kind of an adoption model, how you can make the case, where to get started, where's the biggest bang for the buck, pulling together all the interviews that we've done with different customers across these 5 sessions about how to start, scale, and succeed with your virtual nursing program. I'm really excited about that session, and I already kind of have the outline about just really how this impacts a new way to deliver care, because we're delivering care now is just not sustainable anymore. So thank you both, and I hope to see you all again next month.
Thank you for having us.
Yeah, thank you.
you.
Jacob.